Audio Jungle.
At the College of Health Professions, the heart of our work is bringing faculty and students together to learn together about each other's professions, to learn together about our similarities, and to learn together about the value each of our professions brings to patient safety, quality, and outcomes.
Pace University's College of Health Professions was established in fall 2010 in an effort to showcase the breadth of health science professionals at Pace University.
The college comprises the Lienhardt School of Nursing, established in 1966, and the Pace University Lenox Hill Hospital Physician Assistant Studies program, established in 1997. Both programs are known for quality education and preparing competent practitioners.
College of Health Profession faculty engage in interprofessional practice through their own practice and in overseeing students in clinical practica. Faculty attend conferences to enhance their interprofessional understanding and incorporate this knowledge and experience in their respective programs.
Faculty in the College of Health Professions participate in committees and activities together. However, the initiative this IP team developed and implemented is the first formal IP learning opportunity for the College of Health Professions faculty and students.
Interprofessional education, according to the World Health Organization in 2010, is when students from two or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes.
I believe interprofessional relationship in practice is important because in everything we do towards helping the patient, who is a whole being, we as professionals, whether nurse practitioners, whether registered nurses, or whether physician assistants, we have to communicate together and collaborate to be able to help or treat the whole being.
We're all dependent on each other when it comes to healthcare. Actually, one thing I learned in the military, decisions are much, much better. I mean, I had an exercise one time where I was given a test of some type, and I was graded on it. And then there was two of us together, and I can tell you, two people, for the most part, if we're equally capable, are going to come up with better considerations and a better plan of care. I think it's interesting. I think the students came away with a better appreciation for working in a group. I think when it comes to decision making, the best decisions or the best way to proceed tends to rise to the top, and that's what we're really looking for. We're looking for a patient that's very, very sick, and we just want to provide the best effective care that we can.
The World Health Organization in 2010 defined interprofessional collaborative practice as when multiple health workers from different professional backgrounds work together with patients, families, carers, and community to deliver the highest quality of care.
Well, the importance and value of teamwork to quality, safety, and outcomes in patient-centered care was already known and documented. We were at a tipping point with the passage of the Patient Protection and Affordable Care Act of 2010.
In order to be able to impart the skill sets of interprofessionalism and interprofessional collaboration, it's important for us to start in the classroom area. And we at Pace University really are very pro interprofessional education. By incorporating the interprofessional project that we're doing, we're having the students work together. We're having two different disciplines at this point. It's the FNP students, the family nurse practitioner students, and the physician assistant students. Because the expectation is when they're out in practice, they need to learn how to collaborate and work well together. So the best environment to start them in practicing is within the school environment. It's a safe environment. We give them situations and scenarios that are very helpful and that are real, and then they're able to critique and debrief and look at how they interact with one another, so that when they get out into the real world and they're practicing, they're able to do it efficiently, effectively, and the patients benefit by this.
Educating health professionals for practice in new models is imperative to improving the nation's health.
In February 2011, an important meeting was held in Washington, D.C. to advance interprofessional education to support patient-centered care. The meeting was convened by the Health Resources and Services Administration, the Josiah Macy Jr. Foundation, the Robert Wood Johnson Foundation, and the ABIM Foundation in collaboration with the Interprofessional Education Collaborative.
Interprofessionalism, it's really developing out of, as the medical home has become more relevant, with the new Medicare changes, the decreasing length of stay in the hospital, people in the community more living in the community with their chronic illnesses, living longer, trying to keep them out of the hospital, lower health care costs. It's really become imperative that the patient has a medical home, a medical center, one person who is the central focus of their care, and really collaborating with a team of professionals. And that team of professionals really needs to work together well in order to help keep the patient home, out of the hospital, and living long, and being successful in their own management of their own care, the patient's self-management of their care. So I think that now with healthcare, with the government trying to reduce healthcare expenditures more and more, and with the IOM reports coming out and everyone looking at that, I think that is why there's more now of a focus. And these things come and go. Years ago there was a focus on interdisciplinary care, kind of waned a little bit. It's kind of forgotten about. And I think these things come in cycles, and we're just seeing the next peak of trying to curtail healthcare expenditures and having people work together. And there's been a lot of research showing that the medical home, the disciplines working together, keeping patients out of the hospital, it's pretty successful when it's done well. And actually, Medicare has set incentives for healthcare practices with the medical home. Healthcare professionals who can work together and can curtail the costs and use the electronic health record to collaborate, they're actually getting incentives by Medicare to do this, which is another push for healthcare professionals to engage in this type of practice.
The Interprofessional Education Collaborative consists of the American Association of the Colleges of Nursing, American Association of the Colleges of Osteopathic Medicine, American Association of the Colleges of Pharmacy, the American Dental Education Association, the Association of American Medical Colleges, and the Association of the Schools of Public Health.
4 core competencies for interprofessional education were identified by the IPC expert panel and include values and ethics, roles and responsibilities for collaborative practice, interprofessional communication, and teamwork and team-based care. Within these 4 competency domains are 38 specific competencies that describe the behaviors we should be able to see when the competencies are in practice.
Our main concern, obviously, is the patient and their well-being. And the more people you have involved, and the more people that collaborate with regards to a patient, the better off it is for the patient.
One problem with all that is nobody is looking at the big picture as far as the context of. So you could very well have a patient who's declining, even dying in the context of their disease, but yet you have many different specialists who are talking about improvement in their specific areas of responsibility. So you can have the cardiologist who may be saying that, things are a little bit getting better in this realm, or the urologist is saying that, your lab values are getting a little bit better, but the point is the patient is dying within the context of, and that's where palliative care teams come in, is we're able to kind of present the big picture.
The sooner these relationships are formed within the medical community, the better for our patients. The fact that our students have the opportunity to do this in the classroom before they even enter the clinical forum is fantastic, and it kind of lends to a stronger bond once they get into the clinical arena. It's there, they're going to be part of the medical team.
It's a way to really communicate, to sort of break down walls. I don't have all the answers, and it wouldn't be efficient for me to try to learn all the answers. The way that we can really practice effective medicine is each person brings their special technique or their special skill to the table, and they say, I can bring this. And then another person will say, well, I can bring this. And then the other person, well, I can bring this. And that's when we can come together as a team and practice effective medicine.
I think it's important because we constantly work with each other in a classroom, and actually we don't really work with each other, we listen to a professor talk to us. So not only do we occasionally interact with other PA students, but we need to know how to interact with NPs, doctors, RNs, and keep in mind that we're working on the patient, not on just our personal beliefs and what we want an outcome to be.
And the students need to learn how to work together now so they can work together in the future, and who to consult when, and to kind of be able to have their voice heard when necessary.
I think that is where this interprofessional education will be helpful in helping you come to the next level to be an effective nurse practitioner or physician assistant or whatever it may be in order to practice medicine.
Our goals are to understand faculty and student attitudes towards healthcare teams, and to enhance faculty and student readiness for interprofessional learning, and to help develop the self-efficacy or confidence and skills to be effective interprofessional practitioners. Our work includes developing an interprofessional core competency self-efficacy tool that will be able to be used by other educational programs.
Faculty began their work months before the work began with our students. Faculty met, got to know each other better professionally, developed the scripts, and ran through the simulation, which included rehearsing the actors who play the role of the patient.
So we named our initiative, No Practitioner is an Island.
A concept that we embrace in our own practices. We took up an island theme and even had a contest for the best island dress among the students.
Simultaneously, to support community building, we were working on the first College of Health Professions student, faculty, and staff talent show, which was a successful event held in March and helped members of this community to have fun and get to know each other better.
Well, you also want to do fun things with your colleagues and people that you're going to be working with, so it's just a fun thing to get out and work together, or just cheering each other on, which I think is really important.
It was very interesting because especially at backstage, when the talent show was going on, we were there encouraging each other. And so by the time it gets to your turn, you have so much encouragement for people that we didn't even know. So in that way, we became stronger in working together.
Students were prepared before with simulations with readings and virtual discussions. Our first simulation focused on a patient with heart failure. Over a period of 2 weeks and 4 sessions, over 160 students with up to 10 faculty facilitators participated in the learning opportunity.
Our second simulation focused on a patient with a terminal condition. Her end-of-life palliative care needs would be best met through the efforts of an interprofessional team. For this scenario, the students were each assigned to play the role of a different member of the interprofessional team. It was very powerful.
So first and foremost, it is being done for the better of the patient. Studies have shown that collaboration, interdisciplinary care, successfully managing a patient through a team approach, it actually improves the quality of the care of the patient. It improves the patient's well-being. It keeps them out of the hospital. So, how do you decrease healthcare expenditures with the patient as the focal point? And so there's 2 factors here. One is, what is the best way to provide quality, cost-efficient care for the patient? And really the patient-centered medical home with everybody working together, and with the electronic health record, that's proven to be a successful approach.
I think it's very important. In particular, I'm not really sure that I could do a good job. Let's look, a year and a half down the road, or whenever it is when I'm thrown into this situation. I'll come there ready with all these book smarts or whatever it is, all these facts and lots of medications and ideas and ideas about how I'm going to go in and fix something. But to really put that into practice so that it can be an effective thing where you're not stepping on other people's toes and you're not certain things aren't getting in the way of your ability to utilize those skills that you've learned.
I learned that although I have my own beliefs and I set outcomes for a patient, I really have to make sure that I'm recognizing their goals. And it was very interactive. We all played different roles. I was a nutritionist, and the things that came into my mind first that were going to benefit the patient, although good, were stimulated by everyone else in my group. And it really improved not only like my patient's outcome, but seeing that we're working for a long-term goal.
I just think that in the end of this, that the ultimate outcome is that it's going to benefit our patients, that the students are more prepared now, they'll be more prepared to take care of patients, and that is our goal. We always collaborate in the workforce, and the center of that is the patient. So this is a great start in that direction.
One of the things that we prepare folks for is there are bumps in the road. Everyone communicates differently. Everyone has a different viewpoint in terms of what collaboration is all about. And by practicing the different skills and practicing different scenarios where people may not be the same is important. But I do think that having the opportunity to develop those skills within yourself, specifically the communication piece, it's easier to transfer that to other professions. And what we also look at is you're leading by example. If you're making the communication process and the collaboration process an easy road for other disciplines or for people who may not be as familiar, they learn by what you do. And if we do it in a very non-intimidating way and you help someone achieve a skill set where they can really do this effectively, I think you can change people's minds.
I think we actually here at PACE could do more of it. I know that the nurse practitioners have a very different schedule than the PAs, but I would like to spend more time to learn with them a little bit more and get to know their knowledge and their style, because it is a different style of providing healthcare. As far as some of the other healthcare professionals, the social workers, some of those, we will get those experiences more clinically, and I think it is very important to take all of that into account, all of the different roles that need to be played in a patient's care. But I would like more interprofessional education, just because I think it is important when we're out there working to have that.
Audio Jungle.
In an effort to continue this important work, we plan to expand by bringing in faculty and students from more health professions to add to the value of this experience. For as we know, no practitioner is an island.